I'd just like to welcome you to the CRUK, either in person or virtually. It's fantastic to see people face to face for the first time in a long time, and hopefully we'll get to see people online face to face shortly as well. So, welcome to Cancer Research UK, Radnet City of London. This is our symposium, and really what we aim to do today is really give you an overview of the kind of science that we're doing here in City of London in relation to Radnet, this initiative that Cancer Research UK set out to really understand and fully exploit the potential of radiation. So just a few key points. Obviously, we have a number of speakers in person, but we also have a number of speakers that are online, so we're going to be switching between those as we go along. Please, can you, if you're online, please submit questions to the Q&A tab, and we will read them out. We don't have much time for questions, unfortunately, but we will try and do our best to do that. We also have a couple of speakers, a couple of microphones here for people who are here in person. I think you can read the rest, I think, in terms of gallery view, etc. And we are recording this event. So what we just to give you a flavour for what Radnet is and what we're doing at City of London, we commissioned a video to explain what it is that we do, and this is going to be disseminated to many people, not just within Radnet but beyond. So hopefully we'll get this to work.
Radnet City of London is a consortium of scientific and clinical researchers who've come together in a way to really reimagine how radiation can be used in the treatment of cancer patients.
It involves a number of institutions. There's UCL, KCL, QMUL, the CRUK. A key goal of City of London Radnet, and actually Radnet as a whole, is to work effectively together to collaborate with the ultimate goal of impacting on patient lives.
Half of the patients with cancer receive radiation as part of their treatment.
But at Radnet, we believe that we can really unlock its full potential.
It lead to a significant improvement in the treatment of cancer by fully exploiting the capability of radiation.
We still see a lot of radiotherapy resistance in patients, and despite improving the technology, we are not able to overcome resistance.
The focus of radiation is to damage the tumour. The problem is that you also damage surrounding tissue. So what we're trying to understand is how we can target radiation effectively, minimising collateral damage.
At University College Hospital London, we have a proton machine, which is a type of radiation which spares the normal tissue.
The use of proton beam therapy really increase the accuracy of targeting the tumour with radiotherapy technique.
So what we do at Radnet is really try and combine different types of cancer therapies with radiotherapy and understand how together they can really beat cancer. This kind of research really excites me. It's really about making radiation therapy work better for cancer patients.
The idea is really to bring the expertise that we have in discovery science with clinicians who are actively conducting radiation treatments to patients.
For me, what's exciting is meeting scientists and clinicians who work towards the same goal, to improve survival, to improve the quality of life.
So one of the most exciting things we're doing in Radnet is training the next generation of radiation researchers.
So as a Radnet PhD student, I've been able to work across lots of different sites. I've met so many people. It's been great for kind of collaboration and networking.
For me, I think Radnet is a really exciting idea for all cancer researchers across the UK.
Radnet is very much an initiative from Cancer Research UK, and with Cancer Research UK, we will build a lasting legacy around radiation.
What we're doing through Radnet will really help us treat cancer better, help radiation therapy work better for patients and beat cancer.
Radnet City of London is aiming to reimagine radiation for the benefit of all cancer patients.
Okay, so hopefully that gives you a very high-level flavour of what we're doing here. One of the real benefits, of course, for City of London is our extensive capability. We have a huge clinical landscape. Many hospitals and clinicians are involved in this endeavour, and we have access to some of the latest radiation technologies. We heard about the proton beam capability that recently opened at UCL. And of course, this is only the second site that has this capability in the country, the other, of course, being in Manchester. And we have many other capabilities as well in this space, including LINACs, MR LINACs, molecular radiotherapies as well. And so this is very key, bringing together these different institutions that you heard about, most of which are represented here today. And of course, we then hope to then work together both within London and also more broadly the network across the UK. And we hope in the coming months and years, we hope to really establish fruitful collaborations across the UK and through our international collaborators. So skip that. So just to focus a little bit more on the science that we're doing here. So we have a number of key themes and areas that we are building on. So this is really bringing together expertise across City of London to address certain key questions. Many of the people involved, actually, including myself, haven't formally worked in radiation before, but we have expertise in areas that we think can work effectively to improve our understanding of radiation. And so one of the first themes that you'll see at the top, radiation resistance, including cancer evolution and cancer stem cells. What you see here are the three leads, Tara Kendra at UCL, myself at the CRUK, and Simona Pinarelli at UCL. So we're really trying to develop an improved understanding of what constitutes radiation resistance, which of course is a major problem in the clinic. You know, why are people innately resistant? Why do they get acquired resistance to radiation? How can we tackle that to improve patient benefit? And we heard in the video very nicely from Kebs, from QML, from Bart's, about the importance of radiation combinations. We're now seeing a lot of new drugs that are tackling different aspects of tumor biology, from immune oncology, tumor microenvironment, DNA repair inhibitors. How can we combine those effectively with radiation to improve responses? And again, this is led by Kebs at QML and Eric Sahai from the CRUK. We're also very much involved in understanding how we can effectively target radiation more effectively. We've talked about the problems with collateral damage to surrounding tissue. How can we improve that with better imaging capabilities? And this very much involves improved imaging, targeting, and particularly relevant for mitigating some of the issues that you would have, for example, in treating childhood cancers, where there's still a major developmental program that needs to happen, and how you can mitigate the potential effects of radiation in those individuals. Tony Ng at KCL and Mark Gaze at UCLH are heading that particular theme area. Outcomes and risk predictions, of course. This is all about patient stratification and personalizing radiotherapy. We're using mathematical modeling, artificial intelligence to try and improve not only tumor imaging, but tumor responses using data that we're beginning to collate over time and amass. And this has been led by Gary Royal at UCL, Yasmin Fisher, UCL, and Alan Hackshaw also at UCL. And of course, one of the key things, if we're going to improve the outcomes of radiation in patients, then we ultimately have to translate the discovery science that we're doing. And so there is a very important clinical translation component to Radnet City of London. Of course, what we're building is the establishment of a clinical trials platform to ensure that what we're doing in the lab in terms of discovering new mechanisms underlying radiation resistance, sensitization, etc., actually reaches patients. And so that's something that we are actively involved in. And I should mention Maria Hawkins. She's the clinical lead for Radnet City of London. She's playing an instrumental role in that particular theme area. And I think what's just, I'll leave you with a final point. Of course, these are written out separately, but they are very much, they're integrated. It's very important to us that we can understand how we can integrate these different theme areas more effectively, which is really illustrated in the diagram on the left-hand side, how we're trying to understand how we can bring all of these different components and themes together more effectively. So one of the other key points that was mentioned in the video is all about what I'm passionate about, is about developing the new talent in radiation. So bringing early career scientists into this area from potentially unrelated disciplines, but then applying their know-how to study radiation. And so really that's what we're going to hear about today. We're going to hear about the early career scientists, what they're doing. It's going to be very high level, just giving you insight into their background, what it is that they are interested in and how they're applying that to radiation. So we've got a number of different areas. All of these people have very recently joined Radnet and are starting their programs. And so what we hope is that by presenting their strategies and visions for radiation, this will lead to collaborations within City of London, but also beyond within the network of UK Radnet, but also international collaborators as well. So this first part is going to be essentially open to everybody, but then we're going to have a session after the comfort break at 3 that will be a closed session, which will really allow us within Radnet City of London to discuss some of the areas that we're prioritising at the moment. And actually, this is, for many of us, the first time we've actually met the 3D versions of ourselves. So it's terrific to see everybody, and thank you very much for coming. I hope you enjoy what we're going to present today.